Hi, my name is Layla Way, and this is my med administration video. Today, I'm going to be administering trimethoprim sulfamethoxazole or Bactrim. This is Mr. Bear today that we have with us. He has a urinary tract infection, and so we're going to be giving him his antibiotic. Before I'm going to monitor his skin, we're going to look for get a blood count, monitor his creatinine. This is super hard on the kidneys, and make sure all of that is good. Physically, we're going to ask him if he's got any allergies to any other sulfa drugs or loop diuretics. Like I said before, monitoring his creatinine, make sure his kidneys are good, and then his respiratory rate as well, just to make sure if he goes into a hypersensitivity, we have a baseline for that as well. So we're going to check his wristband. Mr. Bear, explain to him that this is for his urinary tract infection. We're going to check the dose as well, which is going to be 20 milligrams. It's going to be oral, and then the time is going to be 9 o'clock, so in the morning. We're going to make sure to tell him that if he's sent home with this, to take it with food or immediately after eating. So we're going to administer this with his breakfast. We also need to tell him that he needs to take it at the same time every day so that he stays pretty therapeutic with that. We're going to monitor for Stevens-Johnson syndrome, make sure he doesn't have any rash as far as that, and if that does happen, stop it immediately. We're going to monitor his creatinine as well, and his eyes and nose, make sure he's still going to the bathroom. And then we're also going to tell him to encourage intake of fluid, so get more fluids to kind of help those kidneys out. And then we're also going to tell him that he needs to wear sunscreen and SPF 30 to prevent anything happening like sunburn wise. So we're going to give this, check his wristband, scan the med, do all types of stuff, tell him he's taking it orally, make sure that when we give it to him, he's not pickpocketing it or putting it in his pocket or anything like that. Make sure he swallows it, has a okay time swallowing as well. And then as he's taking this, we want to make sure to monitor his white blood cell, make sure that infection's going down, that his output's getting a little bit better, maybe if he's having any burning or anything while he's using the bathroom, that kind of subsides, and then keeping an eye on his skin and on his blood count levels as well. And make sure to tell him that he needs to continue to take this until his prescription is completely up and not stop just when the symptoms subside.